Asthma in children. What is asthma? Asthma is a chronic respiratory condition that causes the airways in the lungs to swell, narrow, and produce extra mucus. This inflammation makes breathing difficult and leads to recurring flare-ups known as asthma attacks. In clinical medicine, asthma is formally defined as a chronic inflammatory disorder of the airways, characterized by variable, recurring symptoms and reversible airflow obstruction. Let's discuss the pathological definition of asthma. Pathologically, the formal definition of asthma relies on three definitive criteria: chronic airway inflammation, persistent infiltration of inflammatory cells, such as mast cells, eosinophils, and T lymphocytes, into the bronchial walls, bronchial hyperresponsiveness, an exaggerated, overreactive physical narrowing of the airways when exposed to environmental triggers, variable airflow obstruction, widespread narrowing of the breathing tubes that is typically reversible, either spontaneously or with the help of bronchodilator treatment. Therefore, asthma is a heterogeneous disease with variable symptoms and variable expiratory airflow limitation, driven by chronic airway inflammation and airway hyperresponsiveness. So, the overall process of asthma will be: first of all, it starts with a trigger like viral upper respiratory infection, allergen, and exercise. These triggers lead to inflammation, which occurs by stimulation of type 2 helper T cells, immunoglobulin E, and eosinophils. Inflammation causes airway changes in lungs like bronchospasm, edema, and mucus production. So the end clinical result of the whole process is that patient presents with wheeze, cough, and dyspnea. In asthma, the airflow limitation is usually reversible early, but chronic disease may cause remodeling. The controller therapy targets inflammation in asthma, while the reliever therapy targets bronchoconstriction, atopy and family history support, but do not prove the diagnosis. So the key symptoms of asthma are recurrent cough, especially nocturnal or early morning, wheeze, shortness of breath, chest tightness. Symptoms vary over time and intensity. Exercise limitation or cough with activity. There is also an important point of asthma to remember. Asthma is suggested by episodic symptoms plus triggers, atopy, and objective reversibility. Chronic isolated cough without wheeze is less likely to be asthma. The danger signs in acute attack of asthma are: patient cannot speak full sentences. Chest shows intercostal, substernal or supraclavicular retractions. Auscultation shows silent chest or poor air entry in lungs. Patient can show cyanosis, agitation, or lethargy. Blood has oxygen saturation is less than 94% or rising carbon dioxide.